What is more personal than our health? Product management does not work if it's dictatorial. And lo and behold, to get my very first customer, my revenue is zero. I have to become an enterprise-grade security company. Something about healthcare feels broken, and I think we all feel this. And it can be better. And as a technologist, I see that opportunity. We believe that the climate crisis is also a healthcare concern.
Hi there, and welcome back to the BeyondProduct podcast. My name is Moshe Mikanovsky, and I'm your host. In this podcast, we're diving deep into what goes into making a truly successful and impactful digital product. We're exploring the unspoken, the behind the scenes, and everything under the hood of product development. Today, I'm joined by Partha, our CTO at Rootquotient. Partha comes with years of experience in building varied digital products and brings in a unique blend of expertise in the healthcare and DevOps space. I'm sure it will be a good addition to our discussion today. We're going to discuss today a very tough problem to solve, one that creates a huge hurdle to startups and organizations of all levels in the healthcare industry, and that is cybersecurity. To help us discuss this, we invited our friends from MedStack. Please give a warm welcome to Balaji, Marcus, and of course, Partha. I'm so happy to have you on the show, guys.
Thank you, Moshe. Good to be here.
Perfect. And after this long introduction, tell us also where you're joining us from.
So I'm in Toronto. MedStack is a remote-first company. We always have been from the beginning. So I have the benefit of working with a team of highly talented Canadians from all across the country, some in unusual remote locations.
And you, Marcus?
I'm joining from Calgary. When I had first joined the MedStack team, I was way out west in Vancouver, and then have slowly built out a team there and then migrated a little bit more eastwards. And so, now I'm settled up in Calgary. Nice to be able to work remotely.
Before that, even Partha, welcome to the show.
Yeah, thanks, Moshe. Good to be here and speaking with Balaji and Marcus. Thanks for having me.
Yeah, of course. I wanted to get from your wisdom as well, because you've done that, for many years and been in this space as well. And you're joining us today from India, I believe, right?
Yep. Yeah, I'm right now in Chennai, India. So I shuttle between Toronto and Chennai, and visiting Chennai for a few months, and we'll be back in Toronto probably in a few weeks.
So you probably have a better weather over there than us in Toronto and Calgary.
Yep. Yeah, of course. It's a winter here, and it's plus 15 degrees Celsius. So that's the winter here. Much better.
Good time to run away from Toronto for a bit.
Yes, of course.
Now, if we would have talked today about climate change or anything like that, that might be a good segue to that, but we're not. We're talking about healthcare and cybersecurity in healthcare specifically, right? In cybersecurity overall, I think the requirements or the posture that healthcare needs are like the highest in the industry.
They are, yes. A health record is worth 47 times that of a credit card on the black market. Which is something that people don't always realize. And that really stems from issues, particularly in the US, around insurance fraud. But healthcare is very, very expensive. And an increasing percentage of the spend of GDP, whether you're talking about Canada or the US or Europe, is dedicated towards healthcare. There are graphs that show how much are we as a country spending on healthcare, and it is going up. And it has been going up even before COVID. Certainly that was an accelerant.
So is that one of the ways that healthcare security is measured, by how much the data is actually worth in the black market?
Well, I mean, that might be kind of a bottom-up way of looking at it, but certainly like the way that it plays out and the dynamic that we see in the industry is because the data is so sensitive, and it should be sensitive. What is more personal than our health, right? Whether it's the medications that we take, the conditions we've inherited from our ancestry, the troubles we have. A large amount of healthcare spend is on mental health. That's extremely sensitive and very important. Therefore, there's a lot of public perception pertaining to the protection of this data from a security perspective, but also, and it's important to call this out, from a privacy perspective as well. And we live in a world where privacy is a completely different conversation now than it did 10 years ago. I have a teenager on social media. I'm living this every single day. And so what ends up happening is those who provide healthcare services, who are charged by the structure of our government to deliver services. Think hospitals and clinics and doctors and nurses and pharma companies and medical researchers. They know that they're being measured by this. And yes, there's questions around fines and such things. I would actually say that the bigger issue for them is reputation. And so, if this calls into question, then their businesses are face a severe wall. So therefore, they put a very high barrier on the vendors they work with of all shapes and sizes, whether they're digital vendors or physical vendors, to ensure that their commitments to protecting those patients and their data remains intact.
Right. Absolutely. So let's pause over here and get back to the origins. Tell us a bit, we want to learn, first of all, about you guys, who you are and how did you get to where you are from now and how did you find this big problem to solve?
Yeah, I can tell the origin story of MedStack, which I think leads into an interesting segue of how we became lucky enough to work with Marcus. And so maybe I can, transition over to that. So we are 8.5 years old. The origin of our company, I believe this is true, parallels a lot of startups in that it really comes from the background of the two founders, the unique intersection between them, right? So I have a background, not in healthcare, but I have a background in platforms. I'm really fascinated by, and that's a very overused word, so I'll define it. I'm really fascinated by the idea of technology that's then taken by other companies to build something new. Think of 100 different offerings that are all very different, and they're valued on their uniqueness based on what makes them different from each other. But in order to be in market, they all have to do one thing that's the same. And so a platform idea says, well, what if they didn't have to do that work and they could adopt it? And by so doing, that element could then be optimized. So I came to this because of a lot of work I did at BlackBerry in the heydays of that company. There were some unique technologies we had there, and my job was to platformize them. So I became really fascinated with platform strategy and its role as an industry disruptor. And I played that role in a few different companies, a few different industries. But I really realized its unique characteristic as by way of platforms, its transformation of very difficult regulated industries. But I didn't really know what that looked like yet. And then I met Simon, who's our CTO and CISO and my co-founder. And he was building healthcare apps as part of a digital agency, especially when the IoT and mobile software revolution took off. He kind of jumped on it right away. And those two things have a very strong play in healthcare. So he came to me and he said, I've built all of these healthcare apps for all of these companies. And half the time I'm doing the same work over and over again. And it's really expensive. I don't mind doing the work. They're paying me for it. But it's interesting. I'm doing the same work over and over again, and it's costing them a lot of money. So we said, oh, that's interesting. So we interviewed a whole bunch of digital health founders. And we said, what is the biggest thing that prevents you from being successful? And they all said the same thing. I built my company. Like, there's easier things I could do with my time. But I built my company because of a passion to make healthcare better. Maybe I'm a physician. Maybe I was a patient. Maybe my life partner is a nurse. Whatever the case might be. Something about healthcare feels broken. And I think we all feel this. And it can be better. And as a technologist, I see that opportunity. So I'm focused on medical science and data science and user experience. And lo and behold, to get my very first customer, my revenue is zero. I have to become an enterprise-grade security company. I don't know how to do that. And that's not work I'm enjoying doing. So they all said it to us. So we chose to focus on that, less because we wanted to build a security company, but more because we wanted to solve their problems as the first problem they mentioned. And fortunately, both of us have a background in security and a passion for security tech and the cloud. And that's kind of how we got started.
Yeah. So how did they get you into the mix, Marcus?
They just threw me in the pits. So my journey of discovering MedStack was through following a passion of my own. My background prior to becoming now head of product running product at MedStack was in engineering, specifically geomatics engineering, so very technical, geospatial, working with satellites, positioning systems.
Oh, interesting.
And that was a really awesome career. There was a pretty clear path that I could go down for that. However, I had this nagging doubt or the founder's itch to do something from an idea that some friends and I had started in university. I asked them if they wanted to take this idea further, and everyone was pretty invested in continuing down their careers. And I was the only crazy one to say, no, I'm going to jump ship. I'm going to take this and roll with it.
Yeah.
So I ended up working with a co-founder, and we created an app called City Connect. And it was a platform that's like Tinder, but for events. to help people basically discover events and entertaining things that are going on in the cities that they're in.
Okay.
So we took that for about a year. And during my journey of being an entrepreneur, I had discovered about a grouping, I guess it's across Canadian founders, called the A list, EH, like how the Canadians would say it. And there was a call to action for people to sign up for the first conference called True North. It's out in Waterloo, Ontario. True North 2018. I said, why not go to that? Went, connected with a bunch of great people, and promised myself I'm going to go back to this pretty much every year as best as I can, until COVID hit, and that kind of rocked everything with it.
Yeah.
But going back in 2019, I remember seeing a talk about healthcare, cybersecurity and healthcare. And one of the key things that caught my attention was the stat that Ball presented around how much more valuable healthcare data was than a clean credit card. That stuck with me. And from that talk moving forward, I was basically hounding MedStack and Balaji. I was looking on AngelList at the time, which is now WellFound. And I was saying, hey, you need a product person. I see that there's a listing out here, poking back and forth. And I think the process, Ball, did it not go on for like 6 months from like the very first touch point until when I was finally hired into the team. The need for a platform at the base of it, I think, is so key. And it speaks to, when the founder or the person who's leading a sale is saying, we need to have this kind of enterprise ready product. It needs to have a security standard that is so high. We've gotten it to the point now with our product where customers of MedStack go and sell into a hospital or another healthcare enterprise, and that healthcare enterprise will say, oh, you run on MedStack? Next question.
Nice.
That has happened before.
Yes.
And when you can achieve that aha moment while sitting aside and seeing your customers be successful in that way, that's a huge celebration of what we built as a platform.
A few other things. And at the time, one of the things that inspired us to move in this direction was Apple was working on something called HealthKit. And we said, we thought, hey, this is the direction that a lot of data structure in healthcare is going to go. So we incorporated an early version of HealthKit into our product. As we got experience in the market, what we realized was that the founders of these companies required a level of ability to differentiate a level lower below that. So we actually said, you know what, we should allow them to own the whole data architecture and code base. The only thing, the layer we should be at, so we changed the layer we were at, if not the problem we were solving. The layer we should be at is an infrastructure security. Beyond that, it's the same vision today as it was in 2014.
Amazing.
Yeah, it's really interesting to learn about going to the product from the platform perspective and approaching it from the technology angle. So one thing that intrigues me is like from my experience of working with healthcare clients and also being in the space, healthcare or like hospitals or the healthcare institutions are actually not early adopters of technology. They are really kind of pushing the technology to its utmost brim, and only if there is a need, they kind of update it and they kind of go for it. But you being in the DevOps space or a platform space, this is something latest technology that is coming in there and that's always evolving, and you need to be on top of every infrastructure updates that's coming in and going in. How do you bridge this gap between an industry that is not an early adopter, but you being in the latest technology? How do you navigate that, or how do you transition into that phase?
That's a really good question, Parth. And I think there's two parts to this because there's two parallel evolutions. One is the evolution of healthcare, and the other is the evolution of DevOps. So maybe I could talk briefly about the first one, and then Marcus, I think you're probably in a better position to talk about the second one, because they're both happening at the same time, and they're kind of not always in sync with each other. And that is the interesting place that we live in. So one of the things that I kind of figured out as we were growing this company and speaking with our customers, but more importantly, our customers' customers. So our customers are the vendors of the healthcare solutions, and their customers are the healthcare industry, which could be patients, by the way. But primarily, let's talk about healthcare enterprises. There used to be this narrative in this technology space that healthcare doesn't like the cloud. Oh, all the other industries are on the cloud. Everything on healthcare is on premise. So every hospital has a server farm underneath it, was this thought that everybody had. And so I dug into that. I was really trying to figure out, why is that thinking in place? And literally, 9 years ago, when people heard we were doing a automate security compliance in the cloud for healthcare, one of the first questions I would always get would be, why cloud? Shouldn't your thing run on premise? Because that's what everybody in healthcare does. Maybe with the possible exception of the Mayo Clinic, right? And what I realized that was actually happening was those who sought to improve the innovation posture of the healthcare enterprise. So we're bringing in technologies for better patient experiences, better continuity of data, better processes and resource efficiency of our people and equipment inside the hospital, would be looking at these different technologies. And then they would say, well, in order to be able to implement this, I need the permission of IT. And then they would go to IT and IT would say, I don't know what the security is, so no. So then that, through like a 5-year-old's telephone game, if I can use that word, that translated into the idea, oh, they don't like the cloud. It's not that they don't like the cloud, it's they don't trust the way the security has been built in the cloud. But what they also don't want is the responsibility to build and run everything on premise. They're busy just trying to keep the hospital running. And so when I talk to CISOs and hospitals, they kind of roll their eyes and go, oh, just one more app I got to look at. I don't have time for this. And so that, I think, is the thing that we've tried to build into both our technology, but the way we talk about our product is it's security as if your CISO had built it herself. And I think that's the way we're thinking of it. But what has accelerated this conversation is the biggest cost in healthcare have to do with continuous patient experiences. And this, so you'll hear this industry term called value-based care, right? What is value-based care? Value-based care says that we reward society by making a person healthier, not by how much time they spent in a bed in a hospital. And that is an early evolution. It's very difficult to do with the economics of healthcare, whether it's Canada in a public healthcare system or the US in a private healthcare system. But the element of value-based care recognizes that so much of the cost of our healthcare have to do with things that people live with for a really long time. I'll give the most personal example I can give. 1 week ago, I was with my doctor, and my doctor told me I'm basically going to be going on a new medication because of a condition I'm going to be living with for a while. And so think about what that journey looks like. So you have your doctor involved, you might have therapists, you might have a caregiver, you might have your family. And so you need to have this continuity of data. Well, every software person will tell you the only way to have continuity of data in the modern world is the cloud. And so that's actually what's caused more attention on this kind of conversation. And you will see healthcare start to move into the cloud with the notion of things that are outside of the hospital. And by the way, a large amount of healthcare doesn't happen just in the hospital. It happens in our lives all around us. So that's that side of the equation. But meanwhile, as you said, if you think of the app vendor in the middle, you have the evolution of healthcare on one side, and you have the evolution of software and DevOps on the other. We knew that was a moving target, which is why one of the reasons we brought Marcus in, because it's a space that he has some experience and insight into.
Totally. Yeah, building a platform that has a multiplicative effect on the ability for product teams, engineering teams to deliver iterations of the product faster into market is key to be able to do this. There is an aspect of really what DevOps is as it relates to the customers, and that's ultimately helping product teams bring a solution to customers faster, smoother, in more repeatable ways. And in healthcare, security is at the center of that. So one of the keys in our evolution here is by trying to make one of the endpoints of where the data lives, where the environment is that the app is running, that the customers interface with at the end of the day, or the hospitals interface with at the end of the day, is highly secure. We've built that in a way that is directly translated, as Balaji's mentioned, to the way that a CISO would create it. So there are a set of privacy and security policies that govern what is actually done in the deployment pipeline. And that translates to a user experience for a developer that's a single click. Create one server, create one database, and all of these operations are happening to protect that endpoint and ultimately the data that's on it.
Right.
So that was something that we knew would be absolutely critical to empower app-based digital healthcare.
What I'm also hearing from both of you is that on one hand, you dive into the real why, like a real product manager, right? Why is it that they don't like the cloud? It's not because they just don't like the cloud. It's because they have a different problem, which is the security. And then why they have the security? because they can't build it or they don't want even to deal with that. And then on the other end, it seems like by your platform, you started enabling a very different discussion, saying, okay, let's break that pattern and insert MedStack in there to say, okay, this will solve that specific problem. So that sounds like a very great place to be, absolutely.
Mm-hmm. Mm-hmm. Yeah, and well, I mean, as we evolved as a company, that led to another interesting discovery, which is really characterize the way we think about our messaging and our product strategy and prioritization and feature set, which is the dynamic intersection between the life of the software developer and the life of healthcare, right? So you can think of the software developer as like, I'm concerned about architecture, I'm concerned about features, and I'm concerned about developer productivity. And this isn't really the case, but just to express my point, I don't care whether I'm building a patient app or I'm building, something that washes your dishes, as long as those things are taken care of. And then the other side, you have this conversation that says, we only care about the outcomes for the patient and the provider. How that happens, whether it's software or it's construction paper, is irrelevant. And I'm sort of illustrating that. I think the kind of question Partha was sort of asking, that intersection has really sort of come to the forefront in the way we think about our company, because it's not just a case of our customers and their customers. That dynamic exists within our customers themselves, because you have the software engineer who, by the way, may not even work for the company. They could be at an agency. And then you have the founder who's facing the technology and security review from the hospital and just trying to sell and show that they've made progress to their investors and their stakeholders, who's coming from a different perspective. And we've had to walk that line. And I'm kind of saying this because it's actually been a little bit more challenging than we expected it to be.
Yeah, that was my next question. Sorry, Moshe.
Yeah.
So that was my next question for Marcus. So you mentioned about going deep on technology side, one thing. And the next is the value-based care. So going deep on technology is you need to know about the technology, you need to know about the infra, you need to know about how DevOps works, how the framework works, and all other things. But for the value-based care, you need to know about healthcare. You need to know about the subject matter expertise. You need to know about what is HIPAA and what is that. So how do you toe the line on both of them? Like, is it something? How do you handle that?
So from a product perspective, those are two very different kinds of ways that you can support a technical person who's running and depending on your platform. So what we focus on is the developer enablement piece. By focusing on developer enablement, you can give the entire technology team more capacity so that they can put their best people on solving business problems, on solving customer use cases, and responding to making sure that at the end of the day, who they need to support are successful with their product. So by creating a platform that effectively empowers developers to get a multiplicative effect on how many people are actually required to just power and support a cloud environment, you can allow the team to focus more on the actual business and end customers of their company and their products.
Yeah, Marcus just used a really important word there, which is empower. And there's a product management construct that I learned about actually from a friend of mine many years ago that I have droned on about with my team several times. But I think it actually carries a really important weight here, which is the idea that every part of a value proposition of any product, no matter what space it's in, falls into really one of two major categories. And you might call them empower or enable, and they're not the same thing. So empower means I'm going to make you proud of your work, and it'll be faster and more effective. Enable means there's something you have to do, but you don't know how to do it, and we're just going to do it for you. And we're trying to do both of those things. The enabler is usually the thing that you sell because it's the delighter. It's the magic that they don't understand, but if they didn't have it, they would have to learn it. But the problem is if you don't do the empower well enough, then that ekes into the value proposition of the enable, right? So there's this product management construct called the Kino model, which we really rely on a lot, which says some things are things you have to do, and some things are things nobody expects you to do. But if you do them, everybody's going to be delighted. We've built that into every element of not only our product feature set, but also our product marketing and our messaging around what are our delighters and what are our enablers. But it's easier to say to do because they're two completely different streams of work. And so we think of the enablement as highest level of security, privacy, and compliance. You don't need to your point, Partha, you don't need to know what HIPAA is. If you come at MedStack, we'll answer it for you because we've taken care of it. But we can only do that if you trust us to make sure we're also empowering the people who work in your company.
Right. So let's dive maybe a bit more detailed or a bit more specific example from the product, because we talked a lot about what the area you're working on, what's the problem you're trying to solve. Now let's talk a bit about the product itself, and part of the product you have also a bit of a service as well that you can offer. But give us an example there. How do you enable and how do you empower people with a specific feature of or set of features of MedStack?
Do you want to take this ball, or I'll take it?
It's all yours.
So there are probably 3 key aha moments in the product that deliver value for our customers. The first one is with an administrative compliance platform called Exos. This is a product that we recently introduced to address the remaining gap. Things like having an actual portal and process for your policies, your procedures to make sure that the right people at your company know how to safely handle healthcare data if they come across it. That includes things like training. It includes playbooks on being able to do data recovery, and that is tightly coupled with the MedStack control platform. So the aha moment in Exos is when evidence is being generated and you can see that you are actually providing proof that you're addressing the specific requirements of your compliance framework, be that HIPAA in the US or PIPEDA in Canada. The next in MedStack control itself is actually getting an environment up and running. Some great companies like DigitalOcean have made it so easy to be able to spin up a server and then to be able to deploy to it. And we wanted to bring that same kind of experience into a healthcare suitable platform. It's not just healthcare ready services, but everything is ready to go to handle healthcare workloads. So in pretty much, if there's 3 key steps, 3 key user workflows that we measure, and the faster that flywheel happens, the more successful we know that our customers are on our platform. But that's effectively being able to spin up a server as a prerequisite, and to be able to configure a Docker service and spin it up, shell into it, view logs, and iterate on that entire feedback loop. One proxy metric for the advancement of, or I should say, the sophistication of a technical team is how many times they can deploy to production. And so the more frequently that our customers are deploying to production without having errors, we know that we're actually enabling their teams to move faster. And so the developers and the SREs or the DevOps professionals at that company get to see that and experiencing that feedback loop. And of course, the third aha moment, which cascades right down to the business team, is when the business team is going into selling to healthcare enterprises or hospitals, and they're talking with the CISOs or the CTOs at those organizations, and they are receiving a security assessment. We call this a vendor security assessment. Because there are a set of immutable controls on the MedStack platform, that healthcare enterprise can hand over a document to our customer. Our customer will take that document and say, hey, 90% of this is relevant to what MedStack does. Hand that over to MedStack. And then we run that through an NLP engine that's directly tying questions to the actual policies and procedures that we put in place as a business. So then we can respond back. We've guaranteed our customers it's happening in less than 5 days. In reality, it's happening in 2.7 days is our average turnaround time. And I think it's actually recently bumped down just a bit faster than that. This is such a fast turnaround time to enable a sale to move along quickly.
That's amazing.
We know that in a sales process, time kills deals. So if you can respond to this faster, if you can get high quality information and answers about how you handle security and privacy, that improves the chances of success of that customer being able to close the deal. So when a vendor security assessment is checked off, that's a huge measure of success for our customers. They land a deal and the flywheel just keeps on spinning.
Yeah.
So where do you kind of stage or put your platform? Is it a SaaS? Is it a PaaS? Is it something else? Or does it even matter for us to define what it is?
Yes. It's yes. Everything.
Yeah.
A platform as a service is a kind of software as a service. The software that we've built, the technology that we've built, is a platform that ultimately gets deployed to. But at the end of the day, I think the key differentiator in how people look at a PaaS solution versus a SaaS solution is how they are comparing it to what you expect for bare metal companies. And so that would be, as a PaaS, I'm paying for usage. I'm paying for the space that I occupy. Whereas a SaaS is perhaps more like a per seat model or a subscription model. But at the end of the day, we've been able to build a platform and find tremendous success by positioning it and selling it as a SaaS.
Yeah.
Interesting.
Yeah, and it comes back a little bit to what I was saying earlier about the different parts of our value proposition, the enabling versus empowering. So empowering is very much like a mechanics of a SaaS and PaaS type solution. Is like you're empowered. There are things that we do that maybe you understand, maybe you don't understand, but it doesn't matter. They're just done for you, and then you're free to do what it is you need to do. So we'll charge you for what you use. So it's a subscription and maybe usage element of a model. The other side is the enable piece, which is like we're assuming you don't know very much, but you trust us to know what we're doing because the people who are going to evaluate, they know what they're talking about. So here is a SaaS product that will walk you through the process. But we know you might need a little bit of guidance on that. So with the SaaS SaaS product, we will offer Q&A of a person to help you with how you use it. So the first half of the product doesn't need a person because they know what to do. The second half of the product does need a person because we assume it's new for them, which it usually actually is.
I see.
So I have a follow-up on this. So if I understand it right, the end customers or the people who actually use the product are developers and who derive value out of the product or CISOs or the healthcare enterprises that focus on the security side. So this is where the infra piece comes in, and that is where you need to go as a PaaS or like the pay-as-you-go model or as you scale in. So that piece comes in. But when you look at the developer angle, it's like per set basis, like per licenses, per things. So how do you position in that particular angle? Is it like the developer is someone getting in a value, but the CISO is also someone getting in a value? How do you balance it out, and what was your strategy in making it a success?
Because there's a third person whose name you didn't mention, Partha, which is the CEO of the vendor company. So you have the buying enterprise, the CISO, and you have the developer user, and then you have another entity in the middle, which is the person who puts the two of them together. And they realize the most amount of value because they get to commercialize what it is their vision was. And as a founder, I can attest how important that is. They're the ones who will go, am I getting value for my money? By satisfying the two stakeholders on either side of me.
Yeah, I think being positioned as a SaaS actually allows us to deliver value between the two different stakeholders. So when your buyer is a different stakeholder than your user, it feels like a solution is being forced upon you. And as a technical person, you don't like that. You say, why do I have to use this certain tool? Why do I have to use this certain technology? Because most of the times engineers or builders, they want to build and have full control and use the tools that they want to use. Right. So the value of giving them, sorry, go ahead, Partha. Sounds like you have something to say in there.
Maybe it could be a controversial thing. So if I have to be a value-driven outcome that I need to go, should I be a SaaS company? And if it is going to be a usage per model, you need to position that as a PaaS model. does that fit it right, or what is your take on that, or how do you see that?
I think it really depends on how the value is delivered at the end of the day and who receives it. So in the case of our product, where at the end of the day, by running on MedStack control, by using MedStack products and services, the company is able to sell faster, is able to cover less surface area, to own less surface area of privacy and security compliance. By doing that, you're effectively giving developers an aha moment where they can spin up something very small, a very small environment, deploy to it, which is a workflow that developers do day in and day out. And when the business is growing and selling into other enterprises and they're getting questions back, instead of those questions flowing through to the developer, they're actually bypassing. So the developers also receive a benefit when the business team benefits by saying, hey, instead of being roped into answering questions, I actually don't have to think about that. I can keep my head down, focused on solving real problems for the business, for our customers, for our users. So the benefit of that business person is also inherent by side, the benefit of the developer, where they don't have to get drawn into things that they otherwise would have to. Yeah. If we were a platform as a service exclusively, where you just charge for server hours, uptime, and usage based on that, then you couldn't have a strong business model around the intrinsic value of the policy mapping directly to what's actually implemented in the product. Someone could spin up one server or two servers, and their prices would be different, but their value would be the exact same, which is why in this case, SaaS makes complete sense for our platform.
I know, Partha, you want to dive deeper into this related to what is the role of the developer in security and security by design and all of that stuff. Before we get that, and we'll do that in a few moments, I still want to stay a bit on the product perspective. So we talked about PaaS and SaaS, but when you have so many stakeholders on the client side that you need to make sure everyone is happy at the end of the day, how did you put together like a certain process in a product management process to collect different type of information from them, to see what level of how pleased they are with the system or not, etc. And how does that impact the way that you actually make decisions to build? Because there is many tensions in there.
Yeah, definitely. And this was addressed with a process that I introduced probably more than 2 years ago at MedStack called inputs to product. Inputs to product has allowed all the different functions of MedStack to be the eyes and ears for product. Mm-hmm. So the way that it works is for the teams that we were working with, which were sales, marketing, customer success, support, and engineering. And then there was one off week to be able to like process, synthesize, and put together the common threads. So this was a 6 weeks cadence for us at our company. And each week it amazed me by just simply asking each of these functions to bring me a perspective of how they see the world. Mm. That was the only prompt. And from that came birth of this slide. There were slideshows, there were pitch decks, there were demos that were done for each team to be able to show how they were seeing the world, how they were seeing customers, how they were seeing their function play a role. Mm-hmm. And what that has done is it showed key highlights on how the market were self-selecting with our product based off of their usage on our website. It was shedding insights on key things that customers need to be successful, mm-hmm. Reasons why they had to look elsewhere, or reasons why they continue to grow and stay with us. It shed light on why deals came through to fruition or why they failed. It shed light on some of the things that are incredibly valuable for our customers, but that are very intensive to operate and maintain. So it shed opportunity for us to be able to, under our hood of our product, make certain systems run smoother so that we could support more customers. All of these functions pulling in together with inputs to product, they ended up having a common thread, and everyone was saying something differently. but it shed light on a very simple opportunity. Each time we go through rounds, there was one key thesis that came out of it. And so we would take that and move forward with it, introduce it, work it into the roadmap. And that was a really key part of being able to sort out all the differing opinions from all the different angles of our teams and our customers.
But does that also take effect into your prioritization process? Because I've been in the past in situations where I was told you have to take care of these stakeholders more than these stakeholders, or the partners are more important than the end users. It was very different situations, but a lot of B2B to C and B2B to B2C have these type of situations. How do you navigate that?
So I think there is a business strategy that tells you where you need to look and focus in the market. That business strategy rolls down into a product strategy, right? Product strategy can propose what they think are great opportunities, where they see the product being able to grow and have success. But ultimately, it comes down to like the company goals, the business strategy. And that will tell you externally where you're focusing. Internally, though, you need everyone singing to the same song sheet. And if you can't get alignment internally across your different teams so that one team can see how maybe a completely unrelated seeming task is actually impacting them, that's so important. You have to get people aligned. A key example of this is, for example, in sales. In the sales deal, a customer might say, hey, I want to have a certain technology. I want to be able to deploy a MongoDB managed database server. And we say, oh, well, we can't do that in our product right now. So naturally, sales-driven roadmap would say, put MongoDB up on the roadmap, and here's the size of the opportunity. Here's the reach. And if we were able to build this feature, here's the related monetization. Well, you got to balance that with on the support side of things, where we're having an incident. It says anytime that this particular workload gets ran on a machine, the server comes crashing down. So then you have the tension of saying, well, do I focus on getting more money into the business, or do I focus on building a platform that is more resilient for different kinds of workloads? And so when you can translate the problem, like say the business strategy is retention in this case, your growth strategy is a retention strategy. You say, okay, we have to make the platform more reliable for our end users so that they don't encounter these things. We can decrease the burden on support. By decreasing the burden on support, by focusing on this particular operation problems for engineering, we create more capacity down road to build more features so that we can then next deliver that feature that's going to help increase our reach in the market. So that's the prioritization. That's the way that you can communicate that to the sales team. It says not only do your customers come in, but hey, to the account managers, to the CS person, once they're in, they're probably not going to leave because they're not going to encounter that problem. So chicken or egg, I say solve the retention problem. Usually once you have actually like a product that has people flowing into the business. But that's how I would look at that. I like to look at saying no actually is something that I don't do that often as a product person. And I'll explain why. People say no all the time as product, right? Default no. But no is kind of like a brick wall. You hear no, and you might hear no why, but I think a stronger answer, especially because all the different functions are brilliant people. You have tons of teams that are coming together, and everyone has usually a very narrow view of expertise in their lane. And they also have empathy and some broader peripheral vision for other people's lanes. When you say no, you're saying no to their lane. And you're telling them in some ways that it's not important. But rather, when you say not yet, it shows that you're heard, you're important, but the strategy says that that's not yet the thing that we got to focus on. I think no is reserved for when things are incorrect, or when things just simply are like, oh, that's not aligned with our vision. Like, for example, MedStack, starting to focus on PCI compliance, but we're not at all caring about actually specifying that for someone who's dealing with healthcare transactions. The answer to that would be no, because that's not part of the strategy. But not yet is saying like, I hear what you have to say in your pipeline. I hear what you have to say that's required to retain customers, to acquire new customers, to alleviate the burden on your systems. Not yet. We can't do that yet, but it's coming. Right? We don't know when, we don't know how, but not yet. that's something that I like to lean into a little bit more than just the brick wall of no.
Right. Awesome. Now, Partha, I know you were itching to learn more about, the security, developers' journey over there, and security by design, and etc. I'll let you, lead the way on this one, because I know this is like topics that you've been doing in the past and involved with. So go ahead.
Yep. Yeah. So thanks, Moshe. Before going on to those technical aspects and those angles, so I just wanted to cover a couple of things on the product side. So you being in the platform business, it's an operational intense business. So you have to have your systems up and running, and you'd have your SRE engineers around the clock and making sure the operations are like top notch. And most of your efforts, or like a major part of your efforts, would be going into keeping up the platform up and running. If that is going to be the case, how do you prioritize the innovation angle of the product? Like, how do you position the innovation angle while you are still being kept on the operation side? How do you balance between them? Running the operations, being a platform company, and innovating on the platform so that you stay on top of it. How do you balance between them from the product angle and also from the business angle as well?
I think in order to be able to stay focused with maintaining good operations and enabling innovation, you have to make very strategic choices. And one in particular was made really early on for MedStack that worked to our benefit was to choose Docker as the underlying platform layer that's running your workloads. Why Docker? Docker can run any kind of containerized workload. You can put almost any kind of database technology, any kind of application workload, any kind of Linux-based framework. Windows as well is supported for Docker, but in our case, we're using Linux-based Docker. You can deploy that workload and run it onto a fleet of machines that is agnostic. It is totally, it doesn't care about what you're running, essentially. So making that strategic choice gives our customers breadth so that they can innovate. One of the key things of our platform is the shared responsibility model, where we clearly lay out the different parts of running your environment that you're responsible for, or MedStack is responsible for, or the cloud provider is responsible for when it comes to platform, security, and compliance. So for our side of things, we want to make sure that the security and the compliance posture is dialed in. That is like table stakes. We want to make sure that you can be able to power up pretty much the core pillars of your cloud, which is having servers, having the servers used for horsepower in your Docker network, having database servers, and then having storage. Those are three key things. And of course, networking wraps around all of that. We want to make sure that that's taken care of and easy so that effectively at the end of the day, you as a digital health provider are being able to innovate with the different technologies that you need for your platform using Docker. At the end of the day, MedStack is a plumbing company. We're not going to be in the limelight for, building the best looking product, the thing that everyone's talking about, but rather as a mercenary, as a plumbing company, if our customers are the ones who are creating those incredible healthcare innovations, we're doing our job right. It's not sexy to be a plumbing company, but it's necessary to be a plumbing company to enable that.
It's very healthy.
Yeah. I
Exactly.
love the way you characterize that, Marcus. And I want to kind of come back to the way that Parth expressed his question. So that passion that Marcus just talked about, that actually pervades our whole company. It's a very unique and maybe strange mindset of people who love working on platforms. That's all of us. Like we celebrate our customers. Like our logo isn't in our customer's product at all, anywhere. Like people may not know they're running on this. And I don't know if I missed something important in the way I described it, Marcus, but it is certainly, I think, no other team could have come up with that because that's just the way we think.
Yeah, this self-service maintenance has become one of the biggest value drivers for our developers. Imagine, having to upgrade your phone And there's a vulnerability in WebKit. So you have to go into, your phone, your Safari settings, go to WebKit, click upgrade, and then go test it. That's not how it works. It says software update available, and you click yes, and then it does it. This can be pervasive to daemons running on the host OS. It can be at the application layer in the load balancer. We wanted to make that a repeatable system. We wanted the look and feel of what it is to perform maintenance pretty much irrelevant of the scope, whether it's like a node or it's an application level thing. We wanted it to be the same kind of look and feel so that users now know what to expect through that kind of pattern. It's basically building the hooked kind of loop, right? You see that there's a little notification, you click it, you see the information about the update, you press go when you're ready for it. It goes, says status, refreshing or installing, status done, check, on to the next. Loop for all the different kinds of maintenances. The value is explained to them and what's happening. And at the end of the day, as a technical user, you understand the magnitude of what that update is and how it means that instead of having to, cancel a sprint to plan for upcoming maintenance, you actually just got to keep on working on features. And we just need to reserve like Monday evening to do a system maintenance. That's a game changer. You bought 2 weeks for it.
One of the things that makes that project so interesting and unique is it had a benefit to all three stakeholders we talked about, and actually a fourth too, right? So the developer now, like upgrading an OS version is not fun for anybody. There's no innovation there. So the developer doesn't have to do that work.
I can completely relate to it.
Right. And also it's a lot of like a mental emotional pressure, but did you miss something in terms of maybe a library that isn't relevant anymore? That's done for them. The CISO at their customer, this is one of those things that they don't catch in the beginning and hurts them later because maybe there's a vulnerability. There's like a 0-day attack or something on the old version and they forgot to ask. That's taken care of now. That by the same token, that late breaking, by the way, did you guys do X, Y, and Z? So you know what, an example of this was, of course, Meltdown and Spectre. Everybody was asking about it. Did you guys handle that, yes or no? The CEO would have a lot of stress around having done a deal, and then at the moment they're trying to get the check, they're asked about this thing they don't understand. So they're taken care of.
Yeah.
But the fourth stakeholder who got a tremendous benefit from this was our own team. Because otherwise we had to do this manually. We upgrade 80 customers in one day with this one feature.
Wow, that's amazing.
So that comes back to the inputs to product. And that's exactly an example that I want to translate for the language, right? CS says, hey, our customers hate that there's downtime. Support's getting inquiries saying, our customers can't have the maintenance be at this time that you selected. They want to do it at a different time.
Right.
Solution, like, let them decide when they do it, when they want to do it on their own. Engineering is saying, hey, it's crazy that I have to upgrade 1,000 servers. We need 5 people on the job, and we have to manage all the queues. We have to handle failures, all this stuff, and we're like all team, all on deck, right? So like those are 3 different perspectives to the same problem. Yeah. Just everyone looks at it a little differently. Yeah. The solution, basically, I bring that problem, and I'm the one who proposes the problem, the way that everyone's looking at it. And really, it's actually the engineers who are coming up with the solution as to how it works. Right. So that's a really key part of this. It's not like product is sitting as some puppeteer with a brilliant master plan on the perfect feature, but rather it's like, I actually understand how everyone's feeling this problem a little differently. How can we go about solving this problem? We start working on scope and trade-offs from there. So self-service maintenance started off by just focusing on Docker nodes, and it's now expanded to impact actually the lower level system of Docker itself, not just the operating system of the nodes, but now into the actual managed services. So a load balancer runs as a service inside of Docker. We now have the ability to run maintenance on those as well. And we're just continuing to build the scope of things that we can give this like one-click maintenance experience to. Not a very sexy feature, but huge value, and taking off the plate something that's very, very taxing on teams to consider for their roadmap, their sprint planning.
And the interface between the two sides of the organization comes into play there. Because can you imagine the CISO at a insurance company telling his innovation team that's handling claims, that plan we had to make an announcement of rolling out this new claims app? I found a Docker vulnerability. And they're like, a doc, what? What doctor? Like, what is that thing? And like, he's gonna be frustrated because he can't justify himself. And yet he has to say no. It's his job. And so these are the kinds of things that it's okay that people don't understand, but it's really important we get it right. And the only way to do this isn't, there was a term Marcus reminded me that our director of engineering coined, security theater, of saying you're doing security when you're not actually doing security. There's no room for that here. Zero.
Yeah,
because people know what to look for and they're already at a point of conservatism. So we have to get it right from the beginning.
Yeah. Just to highlight one more thing that you said before, Balaji, that I really liked is when you build a product that you have to use yourself, so your developers are using it to solve their own problems and to create your own security, that's usually have a much better empathy towards building that product and to the people that are using that.
The first question to think about that we're asked by our customers at the big top of the sales funnel is, well, how much compliance and security do I need? Like there's a line, right? And the answer, no, there's not, right? First of all, there's no such thing as unhackable. Everybody who works in security knows this, right? So the question, where is the line? And the way we kind of figured that out is how we started the company. So before we built anything, when the founders of these digital health vendors were telling us that security and compliance was a pain, we said, well, what does that mean? Like, what's hurting you? And as we dug through it, and when they finally understand what we were asking them, they said, this is hurting me. And they showed us the vendor security assessment. So this questionnaire, which is 400 questions, usually in an Excel spreadsheet, sometimes it's in a piece of paper, that says, did you do this? Did you do this? Did you do this? There are three ways that a company gets evaluated. The first is, show me your policies and I'll let you know if I like them. The second is, answer my questions and I'll tell you if I like your answers. And the third is going to be, I don't trust what you're going to say. You need to go get a certification. At the level of an early stage vendor, number 2 is the one that comes up. And so what we did is we took a whole bunch of those security questionnaires because my partner had been building healthcare apps before, and we just reverse engineered them. And we said, what are the things everybody's asking for? Don't ask me what the minimum security is. I'm concerned in what the CISO's minimum level of security is because I know they're really conservative, because they're really concerned. And it bubbled up into certain things that we were then able to map into a starting point of default security for everybody. We're not going to check the way you've done it. We're not going to give you a scorecard. We're just going to do it for you. And we're going to do it for you in the way that we know would have passed their review because we did it already, which was a certain level of specific infrastructure things like backups and network security and certificates and audit logging and a bunch of other things that we did automatically. Then the next step is we mapped them to evidence for the certifications. We got our certification and we realized that our certification could be inherited as evidence for our customer's own evaluation. That's the process by which we led to that. Now, how we run that on a day-to-day basis is complex. So Marcus can talk about the way we think about those kinds of things.
I think who you have on your team makes the key difference here. And I wish I could just parachute in over my shoulder. 2 key people. One is our director of security and operations, Jody Struthers, brilliant mind who has been at the forefront of cybersecurity, and someone who I fear because of how powerful and capable she is. All the respect to Jody. And the next is Nicholas Bering, our principal architect, someone who's basically built MedStack Control from the ground up. You have to have 2 security first thinkers, people who think as if there were to be an adversary. How could you build a system that protected against that decreased the surface area of possible attack vectors? So in our product cycle, when we're thinking about new features, it's not just talking about what the scope requirements are as it relates to the user experience or how it integrates with our billing system, but rather, what is the opportunity to actually have this what is the likelihood that this might be compromised? So we're always talking about what is the risk likelihood, what is the risk impact of building a certain feature. And we're using that to drive a lot of design decisions and also priorities.
Got it. Okay. So on a contrarian view, or So if you go by a security by design aspect, the first person who gets impacted is the developer who develops that platform. So basically, if you're being a developer and you need to ensure all the security checks are in, that makes the life of a developer difficult for sure. So how do you bridge that developer experience or making it more seamless for the developer? Say be it your in-house developer or be it the developer of your customer, making it more seamless. Or what are the metrics that you go about of making it developer experience more ease? Is it one thing that you mentioned is like the number of times they ship it to the production. So that is something the system that is taking into the production environment. What are other metrics that you see that makes the developer experience easier so they ensure security by design as a default thing, or they go by that?
One of the key metrics that we use for success in the product, aside from the actual interaction with deploying a service, shelling into it, looking at logs, is seeing the adoption of the API. So this is particularly interesting in the DevSecOps space, where people are trusting MedStack as actually the secure endpoint of their application. So the customers who we see who are using our API are actually building what we've built as like an interface, a web application interface to manage your deployments. They're actually putting it directly into their pipeline. So you can't use how many times there's an active session in MedStack control as a proxy for success. This isn't an app where more eyeballs in the application means a better experience. Right. It actually might mean the opposite. So the adoption of the API into their pipeline is key. Seeing how many times services are deployed and iterated on is a key measure of success. That's pretty much like one of the top metrics that we would look at to see how the secure by design is being trusted and actually implemented and put into people's pipelines.
Got it. Talking about the developer experience, me coming in from the technology aspect or from the development experience, security is the thought process that any developer needs to take, or any kind of person who is developing a software that needs to take. What are your aspects, or what is your perspective, or what do you think a developer should consider when they approach security by design, or how should they go about the security by design aspect of developing a software? Not just healthcare, but given that we are in a data intense era, any application that one develop, security is the key aspect that is going to come in. So how should one approach to that or go about it and evolve from there?
Well, where we sit as a platform is at the end of that entire chain, where all the security is thought through a DevOps lifecycle. Specifically, the way that we do it, as I mentioned in product, is we think about what is the risk impact, what is the risk likelihood. The two key questions that we think about through every step along the chain. So if I were to advise on how a technical team can think about security by design, it's to say, if there is a vulnerability here, what's the impact? How can you mitigate that impact? What's the actual likelihood of that happening, to then decide, what is the prioritization of this? You think about that not just with features, but you also think about it in systems that you use. And a key example of how just the entire industry is shifting to security first thinking happened strategically with Docker Hub when they partnered with Sneak. So now if you have a paid Docker Hub account, Sneak is going to do security scanning on your container images. That's something that not everybody thinks about, would implement on their own, but you get it as a perk. So the entire shift towards having the security baseline just be that much higher is happening. Healthcare, it's kind of always been there. But I think that the attention and the importance of healthcare, especially as we've experienced with the pandemic and the dependency on, tying this back to the weather, if there's bad weather outside, can you still go see your doctor? If you can't make it out, is there a way that you can still receive your prescriptions at home? These services are key. I think the entire security by design along the chain is something that you do need to ask yourself. Make selective choices with vendors that are going to handle and reduce the security surface area that you need to think about, so that you ultimately, at the end of the day, can focus on addressing customer problems, building a product that people need, and helping your business grow in a direction that's strategically sound for them.
I found it interesting to look at the different starting psychologies and perspective points of the developers that we talk to in our business, because we have this range from those who say, I know I'm going to need security and compliance, and I am not a security expert, so just tell me what you guys do, and I'm happy to leave it to you, to those who say, I actually know it really, really well. I know all the work that has to be done, and therefore I know how much work it is. So I'm going to make sure you guys have done it correctly, but I'm very happy for you guys to take that. Even to the point where some have actually said, I love the separation layer because I know the mistakes I can make. It's not for lack of knowledge. It's just for being busy. And you guys will actually prevent me from having access to those switches. That's amazing. And then where things can become challenging is where they think they know, but they don't know. And then therefore they face a dissonance with, as Marcus alluded to earlier, with the business leads in their company kind of going, well, wait a minute, I think like this should be my job, and can I do it? And, those kinds of things. And we expected all of that going in, so education becomes a really big part of what we do.
As we are touching base on the DevSecOps and those parts, so if you take back probably a decade back or almost a couple of decades back, there was separate, operations were separate. And then the DevOps came into where the developer needs to know about the operations and those things. And in towards the end of the last decade or last 5 years or so, DevSecOps came in where the developer needs to know about the development and also the security aspect and also the operations aspect. How do you see this transition evolving, and what are some you being in the industry for almost a decade, so you would have come across some really interesting scenarios where this is the point where the DevSecOps has proved it to be a game changer, or this is the incident that could have been avoided if we had taken a DevSecOps approach. So if you can share some of the examples on that, I think that would give us some good perspectives on what gotchas that one should avoid.
For industry examples, I don't think I have a specific case that goes that low level into like the root cause analysis and how it could have been mitigated. But actually, I'm smiling because it comes back to, here's my product mind again. It really is kind of like the Kano model, is it not? Where this standard is changing. The baseline is changing. And if your systems, your processes, your tooling is not adapting to the new standard of it, you're going to fall behind, you'll lose out on opportunities, and ultimately you'll be dissatisfied with what you can produce at the end of the day. It seems like it kind of falls into that, right? That things are constantly moving. And you see that with any piece of technology where, go back to the BlackBerry days. Ball, this is a much better suited topic for you. But like, how has the evolution of the phone and the baseline expectations started changing shape? And then how did that impact the industry and the players in that space? It's all analogous. It doesn't have to be specifically DevOps, but these are just dynamics of how things evolve.
Things become a default over time, and you need to be able to see that coming, right?
It's interesting though, because in this industry, in sector specifically, and when we're talking about hospitals, we still need the hospitals. They will always be there. It's just how they are being run and how efficient they are, and therefore what type of technology they are, using. There are also, of course, other providers, but this is just one big example.
Well, I mean, if I may, I'd like to be a little bit more imaginative than that. And I think if we do our job correctly, what does that mean? That means that the creation of innovations that affect a person's health, sure, there are lots of ways to define that, can be created quickly, can be trusted. Without trust, you don't have adoption. So it can be trusted and can be connected. Then things become really interesting. So the most golden opportunity that we are all chasing right now is how do we help us change the conversation away from mitigation and treatment to prevention. And that's a very healthcare way of thinking of things, but it requires technology. So what can I have in my day-to-day life that might tell me that I need to change something because I have made this much progress on the digital progress bar towards perhaps facing something like cancer, for example. What does the treatment journey look like before I've been diagnosed. I'm at risk. Okay, well, who should I be talking to? What sort of program can I be in? And I really think about, what would happen if it was not just like an app on my phone, but it was all the things in my house were on a healthcare journey with me. What does it look like when my refrigerator is on a healthcare journey with me? And my thermostat, my house.
I love that.
And my phone system says that, oh, wait a minute, like, none of these are my ideas. These are all the things that that our customers are thinking about. That some trigger goes off and a call is automatically routed, a video call is automatically routed to my TV with not a physician necessarily, but maybe a nurse practitioner or somebody that can kind of go, well, let's talk about what you're going to be doing tomorrow, because maybe we need to change things. And I think a lot of the word that's being used in the healthcare industry around this stuff is the consumerization of health. And I think that's really important, and critical to that are two things: the cloud and trust. Without those two things, you cannot do this stuff.
Right. And innovation, of course, from people thinking in a different
Absolutely.
way. So you're right. I was a bit fatalist over there saying that we will always need hospitals. I think we will always need some of the services that they provide.
Yeah.
And there will be space for innovation and disruption there to other providers to give that service. Yeah. And maybe if we have the platforms, the technology, the trust to support those, government will also, approve them, and then they might run hospitals to the ground. Who knows? But that's going to be a very interesting feature.
It's a really interesting feature. I mean, I spent a lot of time in a hospital last year, taking care of my father in his final days, and it was really interesting to observe his experience and our experience as a family around him when he was there, because it felt like half the time people were trying to understand his experience outside of the hospital in order to deliver him treatment inside the hospital. And so it just kept coming back to continuity of data. The term that's used in our industry is interoperability, but it's more than just, does the data structure in one hospital look the same as the data structure in another hospital? What is the continuity of experience? And of course, when you have a continuity of experience from a data perspective, this is the reason why, if I may, that people are saying the most transformative application of AI will be in healthcare. I think that's absolutely true. Because it's already happening, right? So now AI is already being used to look at radiology images to determine the likelihood of propagation of a wound or a tumor or what have you. But you can apply that to anything, because you can look at the entire history of a multivariate data set from somebody's life and make a prediction, not only about what their journey is going to be, what kind of care do they need, what kind of medication do they need, what should we change in their lives so that they can continue to be productive in society. Yeah. I get pretty excited by this stuff.
I'm so excited with that future of healthcare too. Looking at genetic markers, looking at geographic markers, all of this. There's a book called Outlive by Dr. Peter Attia. He's a longevity thought leader and expert. And he talks about medicine 3.0. Medicine 3.0 is about preventative medicine. Imagine if a hospital, if 50% of the capacity for beds weren't needed anymore because of preventative measures that were accessible to everyone. Then you would repurpose those hospitals to say have more medical equipment that is highly niche to the industry, like more MRI machines, which notoriously have a 6-month backlog or more. There's an entire transformation with this, and Bal, you couldn't have said it better.
And just the number of people, and just the number of people that will not die because they got some infection in the hospitals or some malpractice in the hospital. That happens a lot as well.
It does, and then remember, this isn't just one side; it's the other side too. Everybody who works in healthcare, my partner is a physician, and I know lots of people who work in healthcare. They do it because they really want to help people, but they're so hamstrung by the inefficiencies in the system and the data and the structures and the processes and the equipment that it makes it hard for them to deliver the amount of impact that they want to have. And so we see that as important too. So just to give some color to this, one of the first places that AI and generative AI has applied in healthcare is the idea of a doctor's consult. So, we have a couple of companies on our platform doing this, where you have a system that will listen to the patient speaking and will create a physician's report. Because right now, it's a lot of work to write it down, and then you send it to an editor, and then you got to edit it. Then you send it to the referring physician or the pharmacist, and they got to understand it. AI can play a tremendous role in that, and that's reducing burden, right? So we think about these kinds of things.
Yeah.
Some tips to share with other founders if they're listening to this. It could be from anything in your experience, or specifically in healthcare. It could be all of them. But one of the things that kind of connects this with something we talked about before is that vision, and who are you selling to, and how do you convince them that they really need it? But not just them, but also your investors. When you get to the investors sometimes they don't really understand all the details of that, and why should they invest in this, and where the world is going. So how was your experience with that, and what did you do?
Well, it's not a was, it's still it is, right? Because I'll tell one story. I'll tell one story because it's a product story, and given the product orientation of this podcast, I do want to tell it, and it will be something that Marcus will appreciate very, very much. We made a very important product decision early in the company, and I'm going to credit Simon with this, which says, according to Lean Startup, you can't make too many assumptions. You got to put something there, and you got to wait for the customers to use it. This is what Eric taught us all, right? And so the first version of MedStack actually had no product at all. It was a concierge product. We literally were like building it for each customer manually. And that was great because we got to revenue super fast. We got to customer validation in a market where investors didn't really believe in us. But then the problem is it became too successful, and it started scaling, and it was not built for scale. And so we ended up having to build not a pivot, because it is the product we always knew we had to build, but we couldn't build it on day one. We had to build a new version of the product, which was more automated and self-service. And we had to do that while running the revenue of our existing product, which we couldn't let go down because we had to raise money to build the new product. And so would I have done that differently? I don't know, but I do know it was hard. It was really hard because value proposition was the same. Technology was like 100% pivot in a different direction while we had to provide support to our existing customers. And this is the classic innovator's dilemma problem, which is weird to say for a company that was like 8 people, but that's sort of where we were. I think it's hard to know what I would have done differently. I'm very proud of everything we have done. I'm very proud of everything we've done. I think we might have thought about the dynamics between the user and the buyer a little bit differently, a little bit earlier on if I had the insight then that I do now. But that's a very kind of lower level sort of thing.
Yeah. But if you will have to give like your top tips to new founders in technology, what would they be?
The technology doesn't matter. The way your customer recognizes value matters. Really do not underestimate the difference between a buyer and a sponsor and a user. Everything is B2B now, so that's really going to play a role. And there are dynamics around SMB and enterprise and product-led growth and freemium models and all this stuff. You need to think about that stuff really carefully. Don't phone that stuff in. It's super important. And realize their perceptions are going to change over time as the industry changes around you. Get in front of that before it happens. Nothing matters more than traction. Your job, the only thing to convince an investor of are 2 things. And the second, only a few companies have. The first is your ability as a founder to learn and to listen and to leverage your maturity and your experience. I think the fact that both myself and Simon had a number of years of working experience behind us helped. And the second, if you have the ability to just go in and go, you don't need to understand, but here's my patents and all my IP. That's a different kind of company. If you don't have those 2 things, don't worry about trying to convince them of anything else other than numbers. Here's the numbers. That's it.
Yeah. Awesome. These are great tips.
Yeah.
These are great tips. And who knows, maybe if we meet you in 8 years from now, you will have some new tips. We'll see.
Maybe we will. So. Maybe 8 minutes from now. Who knows?
Nice. Very nice. Thank you so much for that.
Yeah, I'll just close with a couple of things. First of all, taking the step of creating something new, whether it's a startup, whether it's a project in a hackathon, whether it's an innovation inside a larger company, all of those are valid. I've done all 3. It's a lot of work, and it's very sacred work. It is the implementation of the current version of the human mind. So take it seriously, and you need to constantly be realizing you're creating stories for your customers to tell. Ask yourself that every single day. Write the value proposition statement, stick it on the wall, and look at it every day going, is this still matter? Does this still matter? Does this still matter? What? And be humble. Maybe I need to change it. I always say when I do these kinds of things, I thank everybody who may be listening who is an entrepreneur. Thank you for what you do, because we need it, and I wish the success. And all of the other fluff in the startup industry doesn't matter as much as are you delivering value to customers for them to be more productive.
That's great. Thank you, Marcus. Anything else you wanted to add or talk about?
I'm good. Nothing else to add on to that.
Okay, perfect. So the one question we always ask our guests is if you want to give a shout out to another product that you really, really like, you can't live your life without it. Please don't mention any of the big ones that everyone already know about, but just any product.
Lenny's podcast is like a product, a product newsletter and podcast that it's just a fantastic landing ground for all product people to come to and learn. That has been really, really important for learning new strategies and tactics, for trying to adapt the ones that I have existing, and also just the collection of information on there is insane. You can think about marketplaces, B2C, B2B, B2B2C, different kinds of product management and thought leaders speak. That one's been huge for me over the last year.
Well, that's great. Thank you so much, both of you, Marcus and Balaji, and of course, Partha, for joining me. Where can people reach out to you if they want to connect with you, Balaji and Marcus?
Go ahead, Marcus.
Yep. Me on LinkedIn, probably the most accessible platform. I'm not too active on X or any kind of platform like that, but on LinkedIn, /in/M Polini, pretty straightforward. Yeah, LinkedIn's a good platform.
Yeah, for me as well. Balaji Gopalan is how you'll find me on LinkedIn. MedStack is at medstack.co, and you can find us both there as well.
Excellent. And what about you, Partha?
Yep. Yeah, I would prefer to go with LinkedIn as well. Sorry?
Awesome. No, that's if people want to reach out to you, of course. Yep. So thank you again very much, Balaji, Marcus from MedStack, and Partha for joining me today at the Beyond Product podcast. Thank you everyone for listening or watching us on YouTube. Please follow us and share, and you can also send us feedback, for the podcast and whatever is it that you would like us to cover next. We'll see you next time.